Well, I get this question quite a lot. If a woman has a family history of breast cancer, can she take hormones for menopause? I'm Steve Goldring from simplehormones.com. I help patients and healthcare practitioners with easy-to-understand patient education resources. Most of those are about hormone optimization. Well, a woman I'll call Marla asked me just yesterday. She said, "Hi Steve, I'm going through menopause and I'm having some difficulty. Since my sister had breast cancer and passed away at age 50, along with my mom, who also had breast cancer, most doctors have basically told me that I'm not a good candidate for any hormone replacement therapy, even bioidentical hormones. What are your thoughts and any research on my type of situation?" Well, breast cancer is a terrifying diagnosis. It's a really big concern for women in menopause, especially those women who've had a family history of breast cancer. I need to start out by saying that this post is not medical advice. You definitely should not change your medical care based solely on this video. It's just information and kind of helping you get some of the facts. I'm not a doctor, a physician, an oncologist, or a breast cancer specialist, so you can take what I say with a grain of salt. My specialty as a pharmacist is teaching people about hormones. I do know a lot of hormone optimization providers all over the US and in Canada and other countries, and they tend to agree with me about the risks of hormones. These are physicians, nurse practitioners, and physician's assistants who have all looked closely at what the studies actually say. They've come to some of the same conclusions that I've come to. The dilemma is real. On one hand, you may be suffering with hot flashes, with weight gain, with irritability, with depression, with anxiety, vaginal dryness, painful intimacy, insomnia. Basically, it's the whole list of menopause symptoms, and there are many more. The women I've talked with in menopause, over 2,500 of them, are desperate for some kind of solution. They're looking for something that'll help them get their lives back. Yoga and supplements and changing their diet and not drinking wine. None of that stuff's really helped them all that much. On the other hand, they're also worried about the risk of breast cancer. Those women who are most concerned about breast cancer risk are the ones with a mom or a sister who's had breast cancer. Some of these women, like Marla, have lost one or more loved ones to breast cancer, and it can be kind of a scary thought. Sometimes their doctors will tell them that hormone replacement is completely off the table for their menopause symptoms. They'll just have to suffer through and wait until those symptoms go away. By the way, waiting out menopause often means at least 7 years for most women, sometimes even longer. It's an impossible situation. Damned if I do and damned if I don't. Well, the first thing that I'd like to say to Marla and other women who have a history of breast cancer in their family is, I'm so sorry you're going through this. I just can't personally imagine how hard it must be to lose somebody so close to something that's so devastating. This has got to just be so difficult for you. And to make things even worse, those menopause symptoms make your life miserable. I know a little bit about that from all my surveys. I've talked with women in menopause who felt like their lives were just over. They felt like they had nothing to live for anymore. And that's also a heartbreaking thing. I've heard from menopausal women who haven't felt heard or seen by their doctors. I met a doctor at a party the other day. As it turned out, he had worked on a team of researchers who were involved with the Women's Health Initiative. That's a big study I'll mention a little bit later. Well, we started talking about menopause, and he joked about telling a woman in menopause, "Get a fan." It's possible you haven't experienced a lot of empathy for your situation, especially if you have a family history of breast cancer and pretty serious menopause symptoms. If you're a woman who is suffering both the loss of a loved one and the struggle of menopause, well, I can't totally say that I understand because, of course, I'll never be in your shoes. I can just barely imagine what that must be like. There are providers who really do care, who don't just say, "Get a fan." The Women's Health Initiative, that study that I talked about, has convinced doctors that all hormone replacement is dangerous. You can watch some of my other videos explaining the big study, the Women's Health Initiative, and what it does and doesn't say. In any case, physicians discourage women from taking hormones for menopause because of that study. Doctors even deny patients hormones that have been shown not to increase breast cancer risk. And that's deeply sad to me and the other healthcare providers that I work with. We're saddened because women suffer needlessly for years with horrible, life-changing symptoms that they could find relief from if only they were offered hormone replacement therapy. The good news is that I work with hundreds of hormone optimization specialists all over the US and some in other countries. Those providers believe that optimal hormone levels are the single most effective treatment for menopause symptoms. They also believe that the evidence favors using just right levels of the right hormones. I'm talking about estradiol and progesterone. Just right levels of those hormones relieve the suffering of women in menopause. Getting your hormones optimized is the best thing for your symptoms, but it's also the best thing for your long-term health. Just right hormone levels don't lead to an increased risk for breast cancer. When they're prescribed appropriately by a provider who really understands what to do with them, they can actually help protect breast tissue from cancer and other tissues as well. That's even true for women with a family history of breast cancer. So the question is, what would I do if my wife had a family history of breast cancer? Well, my wife does have a family history of breast cancer. She also takes estradiol and progesterone to help eliminate her menopause symptoms. Those hormones help to keep her healthy for the long term. Both she and I feel very confident it's the best path for her. We've talked about it several times over the last 15, 20 years. We work closely with one of those hormone optimization specialists I've talked about. He's a provider who's been trained in prescribing hormones. He knows how to monitor them. We're doing our best to make sure her levels are not too high and not too low, but they're just right. As I mentioned, I know some of those physicians and nurse practitioners who aren't afraid to help women in menopause by optimizing their hormones, even if they have a family history of breast cancer. Not every provider, not even every hormone optimization provider is willing to help. Some don't want to step out on a limb and take that risk, but some are. If you do find a hormone optimization provider who is willing to take that risk and help you with your hormones, in spite of a family history of breast cancer, here are 4 of the things that you might experience. First of all, they'll probably ask you for your informed consent. It's really important that you understand the risks up front based on what the research actually says. Not only the Women's Health Initiative study, but a bunch of other studies that go into hormone replacement therapy. A reputable provider will help you understand all those risks thoroughly. A hormone specialist may ask you to get genetic testing. Your genes inform your risks, but that doesn't mean your genes are your destiny. Just because family members have had breast cancer, that doesn't mean that you're doomed to have it too. At the same time, understanding your genetic predispositions can be a big first step toward helping you avoid breast cancer as well as a bunch of other issues. The third thing is that some providers will use a dried urine test for comprehensive hormones, or a Dutch test. This is a test that can be useful in helping to figure out how your body metabolizes hormones, or kind of sweeps them out of your body. Different ways of eliminating hormones from your body, they're called metabolic pathways, can actually lead to different levels of risk for breast cancer. A hormone provider who really knows what they're doing in helping you optimize your hormones may also ask you to change your diet and maybe even take some nutritional supplements. These steps can both encourage those metabolic pathways to move hormones toward safer metabolites that can be easily eliminated and move away from harmful hormone metabolites. If you have both a family history of breast cancer and serious menopause symptoms, that's not a good situation to be in. Your path is not an easy one. There aren't a lot of providers who are willing to take that risk and help you, but there may be somebody in your area. I can't guarantee that I know somebody near you or that the providers in your city are willing to help in your situation, but I'll give it my best shot. If you're a hormone specialist and you're confident about treating women with a family history of breast cancer, I'd love to have you on my provider database so I can offer referrals to some of my patients that ask for it. Click the link that says Join Provider Database at the end of this video. If the video has been helpful at all, click the like and subscribe buttons. I'll look forward to talking to you next time.